Let's study rhinoscleroma. Rhinoscleroma. It is a chronic granulomatous bacterial disease of the nose that can sometimes infect the upper respiratory tract. It is caused by Klebsiella rhinoscleromatosis subspecies of Klebsiella pneumoniae, which is the gram-negative, encapsulated, non-motile rod-shaped bacillus, diplobacillus, considered a topical disease and mostly endemic. Rhinoscleroma. This is the, here we can see, this is the rhinoscleroma affecting the nasal cavity. This is the chronic inflammation, chronic granulomatous bacterial disease caused by which bacteria? Klebsiella rhinoscleromatosis. Rhinoscleroma, so Klebsiella rhinoscleromatosis. This is the subspecies of the Klebsiella pneumoniae. This is the gram-negative and rod-shaped bacillus. So this is the chronic infection of the nasal cavities, which is caused by the Klebsiella rhinoscleromatosis, which is the gram-negative rod-shaped bacillus. On the clinical features, there is 3 stages. We can see the 3 stages. First, the atrophic stage, granulation stage, and the cicatrizing stage. Atrophic stage resembles the atrophic rhinitis, and in atrophic rhinitis, there was formation of the crust and foul-smelling viscid yellow discharge was seen in the nasal cavity. Same in this rhinoscleroma. There is in atrophic stage, this is associated with crust formation and foul-smelling viscid yellow discharge in the nasal cavity. In the granulation stage, granular nodules can be seen that progressively becomes pale red and hard. In cicatrizing stage, there is formation of scar tissue, adhesions, and later stenosis, leading to the distortion of the normal anatomy of the nasal cavity, and sometimes it affects the respiratory tract. So distortion of the pharynx, larynx, and trachea. Here we can see distortion of the normal anatomy of the nasal cavity. For the diagnosis, we do the histopathological examination. In histopathological examination, we see the granulation tissue containing large foam cells. We see the granulation tissue and it is the chronic granulomatous infection, granulomatous bacterial disease. Chronic granulomatous disease. So in histopathological, we can see the granulation tissue containing the large foam cells, mucoelic cells that are scattered among plasma cells, lymphocytes, and the eosinophils. For the treatment of the rhinoscleroma, in early stage, like atrophic stage and the granulation stage, like in early stage, antibiotics is given as this is the bacterial infection. So we give the antibiotics like streptomycin, tetracycline, ampicillin, cotrimoxazole. Nasal pack soaked in 2% acreflavin solution can be used. In cicatrizing stage, surgery need to be done as there is already deformity of the nasal cavity. So surgery need to be done to re-establish the nasal airway, and rhinoplasty is done to correct the nasal deformities. So rhinoscleroma is the chronic granulomatous bacterial disease of the nose that sometimes affect the upper respiratory tract. It is caused by Klebsiella rhinoscleromatosis, which is the subspecies of the Klebsiella pneumoniae, which is the gram-negative, non-motile, encapsulated rod-shaped diplobacillus, considered a tropical disease and mostly endemic. On clinical features, it has 3 stages, which is the atrophic stage, granulation stage, and the cicatrizing stage. Atrophic stage, there is crust formation and there is discharge, which is foul-smelling viscid yellow. In granulation stage, there is granular nodules is formed. In cicatrizing stage, scar tissue, adhesions, and later stenosis is formed, which is distorting the normal anatomy of the nasal cavity, pharynx, larynx, and trachea. For the diagnosis, in histopathological examination, granulation tissue containing large foam cells that are scattered among the plasma cells, lymphocytes, eosinophils. For the treatment, in early disease, we give the antibiotics and nasal pack soaked in 2% acreflavine is sometimes effective. In cicatrizing stage, surgery needs to be done to re-establish the nasal airway and rhinoplasty to correct the nasal deformities. This is all about the rhinoscleroma. You can find these notes on the Telegram and the links are given in the description. Thank you.